So the only reason I have a job in orthodontics to do is that teeth can be moved in the jawbone. And the reason for that is a very specific and unique ligament that connects the root of the tooth to the bone, to the jawbone. Because if there was no ligament in that area, the teeth would not move. And we might think, well, that's great, they won't move. But it's not great because even as an adult, your body is morphologically changing and adjusting, and those teeth still need to move or they would be in greater conflict. It's the periodontal ligament that, again, gives me a job. Oftentimes people are surprised to find that the amount of force required to move teeth is as little as it is. Usually 1 to 2 ounces of force is really what we're aiming for to have the best efficiency of movement with the most comfort and in doing that in the safest way. When we talk about moving teeth, we're sometimes tipping them, sometimes we're rotating them, sometimes we're torquing the roots of these teeth or bodily moving these teeth. One of them would be rotation, or taking a tooth and turning it to straighten it. Another force in action is to extrude a tooth, which means to lengthen it out of the jawbone. Intrusion would be just the opposite. We also at times want to move the root, and that's where the force schemes become much more complicated, where we'll have the orthodontic bracket create a couple, and along with an additional force to be able to get the root moving in a way desirable for improvement of the case for the patient. But remember that we have to keep any movement that we're going to do in the confines of the bony jaw that is the foundation that these roots have to be kept in. So we don't have the ability to go just move a tooth anywhere. It has to have biological bone to both let it move and keep it safe. So this 2 ounces of force that we're kind of identifying as needed to move the teeth is, as you can imagine, much, much less than the 150 pounds of force that you can develop when you're chewing. And so, again, the tooth ligament is what supports the root and keeps it from not moving. So we have to overcome those kind of force bracing with the periodontal ligament by having a light force that is more consistently in place, because chewing is very intermittent, very occasional, and so what makes braces work and actually be able to move through the bone is that force is more of a constant force, even though it's as light as it is.